Gluten sensitivity can look like depression and ADD. That's what I'm going to talk about in this video. I'm Dr. Tracey Marks, a psychiatrist, and this channel is about mental health education and self-improvement. I publish videos weekly on Wednesdays, so if you don't want to miss one, just click subscribe. Gluten sensitivity can look like depression and ADHD, and in this case, the gluten sensitivity is the non-celiac form. So if you don't have celiac disease, you can have a sensitivity to gluten that may or may not affect your gastrointestinal system, but can also produce mental symptoms and other physical symptoms. So what's gluten? Gluten is a protein that's naturally found in grains such as wheat, barley, and rye. Those are the three main sources. Oats are gluten-free, provided that they're grown and processed in a gluten-free environment. Sometimes they're processed with other grains, and so you can get cross-contamination, but in general, as far as their makeup is concerned, they are gluten-free. Some other gluten-free examples would be amaranth, millet, and quinoa. Gluten is like a glue that helps, it's a protein, but like a glue that helps the grain keep its shape. And sometimes bakers will add gluten to a recipe to enhance the shape and texture of a bread. So first let me tell you what celiac disease is about, and then I'll tell you what non-celiac gluten sensitivity is. Celiac disease is a form of gluten intolerance where people who are affected have an autoimmune reaction to the gluten protein. So this means that you form antibodies to the gluten protein, and in general, antibodies are your body's armies to fight off bacteria and virus. So antibodies are good except if they're attacking your body, and that's what we call autoimmunity. So with celiac disease, antibodies form against the gluten, and these antibodies attack similar proteins in the small intestines. And when this happens, you have trouble absorbing the nutrients from your food. So celiac disease it's not that common. It happens about 1 in 140 people in the US have full-blown celiac disease. And if you have it, it's the kind of thing that it's disruptive enough to your life that you'd know it starting in childhood. But then there's this whole group of people who don't have full-blown celiac disease, but they do have a gluten sensitivity, whereby they can have symptoms that may or may not affect their intestines, but they may have abdominal pain, joint pain, fatigue, headaches, and even skin rashes. And in addition to all of that, they can also get symptoms that look like depression and thinking problems that people will describe as a brain fog. So how can you tell the difference between a regular depression and a depression that would come from gluten sensitivity? It's not always that straightforward, but one clue may be that along with your depression symptoms, that you've got other physical symptoms such as joint pain and headaches, and you find yourself having multiple doctors addressing all these different problems. Unfortunately, we don't have a straightforward way to diagnose non-celiac gluten sensitivity. There is some gluten sensitivity testing, but you can get false negatives with these. And then more sophisticated testing is expensive. But if you suspect that you have gluten sensitivity because you have some of the problems that I've mentioned, and the standard treatments for these problems don't seem to take care of all of the different problems, you can try a gluten elimination diet where you remove gluten from your diet and see how you feel. Now, you would have to be gluten-free for 4 to 6 weeks. And then what is normally done is then you reintroduce gluten back into your diet to see how your body reacts. So here's the tricky part. Going gluten-free is not that easy, and it's not something you want to do just because. Gluten-free is trendy now, so there's lots of options to get gluten-free foods, but many of these are processed with hydrogenated oils and high fructose corn syrup. And so they're pretty unhealthy and low in nutrients. The real way to go gluten-free is to avoid the foods that are made with these grains. And because grain-based foods are so abundant, you've really got to do some work to figure out how to change your diet. So you can try eating other grain-free foods such as quinoa, oats, and rice. Another reason you don't want to whimsically go gluten-free is that the whole grains contain B vitamins, folic acid, fiber, and other nutrients. And some diets, like the Mediterranean diet, have shown to lower the risk of heart disease, diabetes, and cancer. And this diet includes whole grains. So if you're gonna do this, you need to weigh the risks, the benefits, the pros, the cons. Also, you need to be all in on the gluten-free thing, which means paying close attention to hidden sources of gluten, like in soups that use wheat starch or barley-containing foods. I have seen it make a big difference for some people. If you're going to do it, though, you do need to give the trial a good 4 to 6 weeks. In the studies talking about non-celiac gluten sensitivity, that was a time frame that they used for the gluten-free elimination diet. And it's not a good idea to fill up on those gluten-free prepackaged snacks. They may be gluten-free, but they're full of other stuff. I hope this was helpful for you. Thanks for watching.